Good evening and welcome to the 18th Annual Lights of Love ceremony. Thank you for joining us for this event. The Lights of Love ceremony is an opportunity for us to honor and remember the special people in our lives in a meaningful way. The Lights of Love fundraiser, which was held leading up to this ceremony, included the sale of symbolic lights in honor or in memory of friends, family members, and co-workers. This evening will honor all individuals for whom lights have been purchased through the lighting of this beautiful Lights of Love tree. The proceeds from Lights of Love support the Cancer Center right here on the Valdez campus and its patients. The proceeds of the Cancer Care Fund are managed by the Blue Ridge HealthCare Foundation. We would like to take a moment to extend a special thank you to our North Star sponsors, Mike and Charlie Bridges, Dr. Greg and Robin Jones, and Sandstone, Grace Heights, and College Pines. This evening, you will hear from several speakers regarding the impact your gift has on the lives of others.
Back in the mid-1960s, before medical oncology and radiation oncology were even established certified specialties in most areas, two physicians here at Valdez decided that they were going to bring cancer care to Burke County. It's made a difference in our region ever since. Dr. Ben Guru began to give chemotherapy based on protocols out of Baptist Hospital in Winston-Salem. And Dr. Emmett White, who was already trained in what then was called therapeutic radiology, convinced the board to buy a cobalt machine as a part of a building program that they had at the time. In 1967, the cancer care program was started, and by 1972, they had added a cancer registry that kept track of patients and outcomes, and the program was certified by the American College of Surgeons Commission on Cancer. That certification has been maintained all those years since, and it has made a tremendous difference in this area. Since that time, multiple trained medical oncologists have come through the program and have served in our facilities. For a while expanded across to the Morganton campus, but now back on the Valdez campus. By 1991, they had recruited a young radiation oncologist, and so we had had several medical oncologists and two radiation oncologists to take part in the program. All of those physicians and the wonderful staffs that they had at the facilities were very dedicated and remain very dedicated to individualization of care, personalization of care, and taking care of all of our patients as if they were our family members. We're very fortunate now to be able to move into a new era. Our board and our administrators, our patients, our communities, our foundation have all remained dedicated to what we try to accomplish, and we plan to establish a new cancer center with the same old philosophies that we've had. It'll be less than 100 yards from our current cancer center, just down the hall, and we expect to be in the new cancer center within the next several years. We look forward to that. We want to thank the Blue Ridge HealthCare Foundation, not only with Lights of Love, but all the programs that they have established to help our patients to be able to move through their cancer treatment with ease. Thank you.
It comes easy for me today to come and speak to you in regards to what the Lights of Love means to the staff here at UNC Health Blue Ridge. We see it every day in our patients and the appreciation that they have in regards to the gifts and the resources that we're able to provide to them as they're going through their cancer treatment. A few things that the Lights of Love provides for our patients every day is radiant gowns, which are comfortable silky gowns for our breast cancer patients. It makes going through their treatment every day easier for them and more comfortable. We have Keep Smiling kits for head and neck patients that really help reduce radiation effect and help improve oral hygiene as they move out from treatment. We also provide nutritional supplements, and I can't tell you how much that means to our patients, because this is a time a lot of patients are unable to stimulate a good appetite or be able to take in the nutrition that they need, and we give out thousands of cases of Boost to these patients in need. We also provide gas vouchers, so enabling people to have the funds to be able to come for their treatment when they might not have been otherwise. We also help provide medications when they don't have the monies to pay for them. We also provide radiation relief creams for skin treatment to reduce inflammation and pain. So when we talk about what this program means to the care staff here, we talk about what the patients are telling us in the care setting, and that is thank you. Thank you for providing this opportunity for them to go through their treatment more comfortably and also being able to provide what they need in a time of need. So thank you from all of us at Blue Ridge.
Hi, my name is Lois Matney. I'm a patient here at the UNC Blue Ridge Cancer Center, and I'd like to thank you for the contribution to the Lights of Love. This has been a very trying time for a lot of us patients, and we are so blessed to have these people to help us and make our lives a little bit better and a little bit easier. And I appreciate everything and thank them so much from the bottom of my heart.
Let me add my thanks to Mrs. Ribbles for joining us tonight. This year there will be approximately 1.8 million people diagnosed with some form of cancer and over 600,000 deaths. Cancer claims more than 1,600 lives a day. Just as we are getting COVID under control, we will someday get cancer under control. Due to early diagnosis, improved treatments, and pharmaceuticals, it is estimated that there has been a decrease in the mortality rate equating to 2.9 million lives saved since 1991. Until that day this disease is eradicated, we will continue to give loving care, aid, and comfort to our patients and their families. This year, we would like to dedicate the lighting of our Lights of Love to the memory of Dr. Clay Richardson. Dr. Richardson began practicing medicine in Burke County 36 years ago. He was not only a fine, caring physician, but he was a strong advocate of our system and what it could and should do for our patients. Fulfilling that advocacy, he served on the Blue Ridge Board of Directors for 12 years and the Executive Committee for 11 years. Proof that no one is immune, Dr. Richardson was diagnosed with cancer last year. As anyone who knows them would expect, Dr. Richardson and his wife Joni addressed the diagnosis, treatments, and his eventual passing with the attitude and grace that can be an example to us all. With us tonight, of course, is Dr. Richardson's wife Joni, his mother, Mrs. Dottie Galloway, and his brother, Dr. Mike Richardson. Could not be with us tonight is his sister Pamela and his daughter Maggie. Joni, Ms. Galloway, Dr. Richardson.
Thank you, Mr. Bridges, for your thoughts and for remembering Clay and honoring the work that he did. Clay was strong-minded, generous with his time, and enthusiastic, but humble when it came to work. He was always grateful for the opportunity to serve this community, and in particular to serve on the boards. He loved it. On behalf of our family, thank you to the staff and providers of the Cancer Center. Thank you to Blue Ridge HealthCare Foundation, and thank you to everybody who donated to Lights of Love. What you're doing matters so much more than you may know.
The lights on the tree represent all lives being honored and remembered. I want to personally extend my gratitude for your support of the Lights of Love. Every gift, regardless of the amount, makes a difference in the lives of our patients. I would also like to take a moment to thank all who sponsored the Lights of Love event. Thank you all for attending.